Alright, so we start by making an anterior incision on the knee. We open up the knee, we expose the patella, which is the kneecap, with the patellar ligament. We evert it over to the side. We start off by preparing the cuts on the femur. As you notice, we're removing the distal portions of the medial and the lateral condyles. We're using a guide that you're going to see placed here for the saw. So once we secure that in place with some cross pins, remove the anterior portion of the condyles of the femur and then the posterior portion of the femur. So now we've made 3 cuts. Now we're doing what's called the chamfer cut, which is an angled cut, one on the posterior portion and the anterior portion, which is going to help with placing our prosthetic device. So now we remove the guide for the saw and we're going to work on the tibia. So we place the guide for that, and then we make the cut with the oscillating saw. If you're wondering, the cuts are about 8 to 10 millimeters, so they're less than 1 centimeter. And now we're going to do the same for the kneecap or the patella. There is a guide too, you just don't see it here, but we make the cut for that as well too, removing osteophytes, which you don't see. We're going to place the prosthetic device. You see the bone cement that they're talking about, which settles really quickly in about 12 to 15 minutes. But before they do that, they place like a temporary device. They try out the knee, they rotate it, they move it around, and then they cement the permanent devices and they place it. We put some drains for the knee, and then you're in the hospital for about a week, and then rehab for about 3 weeks, and then we staple the incision shut.